Hi, I'm Alecia Spangler, the athletic trainer for KSB Hospital. I provide coverage for Dixon High School, and I'm going to be presenting on common sports injuries. So, what I'm hoping to talk about are the different sports injuries I see typically at the beginning of a season, and then prevention for those injuries, treatment that we can do for them, and then when we need to seek further medical assistance. So the most common early season sports injuries that I see are muscle strains, some sprains, patellofemoral pain syndrome, and shin splints. So for muscle strains, there are 3 different grades. Depending on how bad the grade is, will determine the severity of the strain. You can have a grade 1, which is just a slight irritation to the muscle. Grade 2 would be a slight tear, and then a 3 would be there's a complete tear to the muscle. The most common areas that I see are the hamstrings, quads, groins, calves, low back, and the rotator cuffs of your muscle, the shoulder muscle. And most common symptoms for these are sudden pain, soreness, lack of range of motion, and a lot of the athletes always describe it as like a pulling sensation. Also, another thing that they might say is there's a pop. I felt or heard a pop in the muscle. And sometimes you'll see some bruising and inflammation for that. So to help prevent strains, sleep is important. Proper nutrition, having good protein, making sure that you're staying hydrated, having a good dynamic warm-up, which is stretching, going through motions while you are stretching is a dynamic warm-up, and then stretching after your workout. Typically for strains, that's when the muscle kind of is too tight and it gets overstretched, and we don't want that. So the better your range of motion is, your flexibility is, the more likely you are to prevent the injury. To treat a strain, you'll hear me talk about RICE a lot. It's the rest, ice, compression, and elevation. So RICE. You can also do a contrast treatment, which is heat and cold for like a 20-minute session of each. You can also depending on if it's closer on the forearm, you would do a shorter time, like 10 minutes each. You can eat protein-rich foods, massage the area, foam roll it. And I usually tell the athletes to avoid stretching the strain right away because a strain is an overstretch of the muscle. So if we stretch it right away, we're kind of adding to the injury. So usually I tell them to wait about 48 to 72 hours. Okay, so sprains involve the ligaments, and that's what connects the bones to bone. I see a lot of ankle sprains, wrists, and your knee. So if you ever hear of an ACL injury, that's a sprain to the ligament in your knee, the ACL ligament. You'll see pain, swelling, bruising, limited range of motion, weakness. Again, the athlete might describe like a pop. Sometimes you'll hear that. A lot of swelling in the area. So to prevent a sprain, you want to have proper fitting equipment. So for football players, shoulder pads fitting correctly, ankle braces, shoes, any type of brace that you might be having, like a wrist or anything for your sport. Stretching is important. Strengthening, the stronger your muscles are, with strengthening, it helps protect your joints and the ligaments inside. Good sleep can help, and then good nutrition and hydration. If a sprain happens, the way we can treat it is that RICE technique again. So rest, ice, compression, and elevation. Physical therapy, we're going to focus on getting some range of motion back, strengthening the area, and then we can also brace it or splint the area, and sometimes we'll have to tape an area so that they can return to play. Good nutrition is another thing that's important for this, just like with muscles. I often will ask a kid if they like Jell-O because collagen that's in Jell-O, the gelatin, can help with the repairing of the ligament. So every now and then I'll say, hey, do you like Jell-O? Then add that to your diet a little bit to help with some sprain healing. Okay, our next injury is the patellofemoral pain syndrome. This is pain in the front of the knee. A lot of the times you'll see swelling kind of just around the kneecap. Anytime the most the injury is felt is any type of action where you're flexing. So going into a squat or even bending your knees, going up and down stairs, and sometimes just sitting for a long time. And then you will see a lot of that swelling right in the front of the knee, again, around that kneecap. To prevent this, you're going to hear me say stretch and strengthen a lot. It's going to help prevent this injury too. The more flexible you are and the more strength there is on that quad, like your upper thigh muscle, it's going to help prevent the injury. Range of motion, so flexibility again plays an important part. And then proper like running mechanics and jumping mechanics. So this injury I see a lot in my running athletes, and then if they're doing running, jumping, so basketball and volleyball. Okay, we need to see, how are we jumping? Are we landing correctly? So we need to take a look at different mechanics with our athletes. And then proper footwear. Are they wearing good tennis shoes, good running shoes, good sport-specific shoes, so cleats? Is it too worn out? Or are they fitting appropriately, too big, too small? So that's important too to help with prevention. For patellofemoral syndrome, you're going to ice and compress the area if you get this injury, and then avoid the exercising that increases the pain. So if when I'm doing jumps right now, it's hurting a lot, I'm going to take a little break from that. Or if I'm working out in the weight room and I'm using the squat machine, okay, we're going to take a little break from that right now, just to give the knee some time to heal and get back to being normal. Over-the-counter pain relievers can help, and then physical therapy for strengthening and increasing range of motion. Okay, shin splints. I see this a lot in all of my running athletes. A lot of the pain they'll say is in the front of their leg. You'll see some inflammation, not too much all the time. The pain they'll describe, well, it just really hurts when I'm running, or, oh, it's not too bad when I'm walking, or when I'm at rest. Okay, that's good. It's when the pain starts to hurt also when they're at rest, then the injury has progressed too much, and we're now have to think about a stress fracture or stress reaction to that shin bone. To help prevent shin splints, strengthening and stretching, again, want to keep working on that. That's not just incorporating the whole leg, but now we're working like that ankle and like the foot. Want to make sure our toes have good range of motion, everything. Proper footwear. Are the shoes worn? Are they fitting appropriately? Do we need to get arch supports? And then good mechanics of running. A lot of times we will take the kids out and we'll just monitor their running form to see if that might be leading to some of the shin pain that they're having. If this injury occurs, some treatment, again, rest, ice compression, elevation, over-the-counter pain medicine, and physical therapy for strengthening and improving your range of motion. And then orthotics sometimes can help. Getting a little extra arch support in the shoe can sometimes help alleviate the pain of shin splints. Okay, and then when to seek further medical attention. If the pain is not improving or it's just getting worse, we need to go see a doctor. If then there's numbness or tingling, or if there's any type of obvious deformity, that is definitely when you need to go see a doctor, go out and get further medical attention. We don't want to wait too long. It can just lead to the injury getting worse. And that's all I have. Thank you, and hopefully good luck on all of your sports seasons this year.